Follow us to stay updated on debates, discussions, facts, and tips about health. Click on the subscribe button and the bell icon for latest updates.
Hi everyone, a very happy World Blood Donor Day. Most of you have heard a lot of myths around blood donations. टैटू है तो ब्लड नहीं डोनेट कर सकते, पियर्सिंग है तो ब्लड नहीं डोनेट कर सकते, डायबिटीज है तो ब्लड नहीं डोनेट कर सकते. So many myths. So today we have a very special guest coming right in who will be answering all the myths around blood donation. We have with us Dr. Sangeeta Pathak, who is the head and senior consultant for transfusion medicine at MAP Super Speciality Hospital, Sake. She has an experience of 26 years in the industry and is also a certified NABH assessor for the blood banks from the Quality Council of India. So let's welcome her and hear if we fall under the category of donating blood or not. Welcome to the channel, Dr. Sangeeta Pathak. THIP Media is honored to have you here on World Blood Donor Day. Anything that you would like to start with?
Namaskar. Thank you so much for having me here on the World Blood Donor Day. And this day's importance, we all know so much. And this day basically is the celebrated because it's the birthday of Karl Landsteiner, the one who invented the blood groups. And it's because of that this day is being celebrated. And every year, WHO gives it a different theme. And this time, the WHO has given it a theme of like celebrating 20 years of giving. Thanks to blood donors. That's the theme this time. So we are, and this day obviously is for thanking the blood donors, the blood donor motivators who actually bring in the voluntary donors, who inspire people to come and donate blood. So it's all about thanking them.
Thank you so much. And you have been doing a lovely work in the field itself. You know, blood donation is a vital practice that saves countless lives, not in months and years, every day. And we've seen that. But there are so many myths, around blood donation that often discourage people to stop donating. So
Correct.
today we will address all the myths with you.
Correct.
We'll just quickly dive into it. So the very basic question and the question that strikes to everybody's head: are there any age requirements for donating blood?
Yes, definitely. The first and foremost is the age requirement. And in India, it is between 18 and 60 years. Then, but you can also donate between 60 and 65 years as well. But that first donation of yours should not be between 60 and 65 years. Otherwise, you can donate from 18. The mandate which says is 18 to 65 years, but provided the first donation is not between 60 and 65 years.
And are there any specific weight requirements that goes along with it?
Yes, of course, the weight requirements also are there. Like the minimum weight which is required to donate blood is 45 kg. So if I talk about how do we go with the weight scale, is that 45 kg till 55 kg, you can donate 350 ml of blood. Okay. Which usually in many of the practices I see that because the females will weigh less, so they will donate 350 ml of blood. But the ones who are more than 55 kg will donate 450 ml blood, and 450 ml of blood is more helpful for us because the 450 ml can be divided into various components of blood. And these components we all know, like they are the red blood cells, the platelets. We know so much about platelets when we are into the dengue times. We hear so much about it, isn't it? Then the plasma required in so many conditions. One major condition which every one of us will know is like when there is someone who's got a burn, when someone is bleeding, then the coagulation factors are required. At that time, plasma is required. And if we recall the COVID times, at that time, the plasma, the convalescent plasma was so much, everyone was running after that. So plasma was used at that time. So these are the various components, and these are according to the weight that we would be taking the blood and be divided into these components.
All right. And, there are people with certain medical conditions that also hear myths about blood donation. So are there any medical conditions that restricts people to donate blood?
Okay, so there are many medical conditions. The biggest medical conditions that any one of us would know is diabetes. Most of us, our population has diabetes. So they'll ask, can I donate blood while I have diabetes? And yes, you can donate blood. And provided you are on oral hypoglycemics. What are those oral hypoglycemics? When you're taking a tablet and you're not on insulin, then you can means donate blood. The next important thing is hypertension. So many of us are suffering from hypertension. So when they come to the hospital, they say, no, I'm having hypertension. How would I donate? So if you are having hypertension, but if it is controlled between 100 and 140, the above 160, the diastolic, and I mean the upper one. And if your blood pressure is between 60 and 90, the lower one, systolic is the upper one, diastolic is the lower one. So then you can donate even if you're on some medication. After medication, this blood pressure is between this range, then you can donate. Now, another disease is thyroid. So common. So common, with every second female will come and tell you, oh, I'm having thyroid. So thyroid also is such a condition where you can donate only if you are euthyroid if you are not on medications. Thyroxine pe hote hum log jata hai. So thyroxine doesn't permit you to donate. And there are autoimmune disorders in which you could have an euthyroid state. In that you can donate. But if you're on hormonal treatment for thyroid, then you can't donate. Then if you have hepatitis, people will come and tell me, I had jaundice. Isn't it? I had jaundice. So now when I talk to the lay population, ki kaun sa jaundice hua tha, which jaundice? So people don't know what type of jaundice. So there I will exclude. I will say, if you have had jaundice, then I will not take your blood. Good centers will not take blood after 11 years of age if you had jaundice. But our mandate, means when I talk about our mandate from the DCGI, it says that if you had recovered from jaundice after 2 years of recovery, you can give. Okay. But other good centers will say, no, we will not take after 11 years of age. So if you had hepatitis A and E, these are milder form of hepatitis, then you can donate. But if I ask a layman, kaun sa hepatitis hua tha, he would not know that. So hepatitis B and C are permanent deferrals. You can't donate blood in that. So you have to be very sure when you're talking about hepatitis to your donor, what type of hepatitis you had. Abhi now convulsions hua. Someone had fits. He can't donate. Epilepsy hua. He can't donate. Tuberculosis, if he had tuberculosis, then tuberculosis he can donate after 2 years of full recovery. Then he can donate. So these are some, day-to-day diseases that come, like typhoid. If you had typhoid, so many of us would suffer from typhoid because of water, because of some food intake, from some unhygienic food and water intake. So 12 months after you recovered from typhoid, you can donate, not before that. Malaria, if you had 3 months after recovery, you can donate. So like that, the list is endless. If you remember some and if you ask me, I'll keep on telling you.
I heard somewhere that people with PCOD or PCOS can't donate blood. Is it true?
No.
No.
No. It depends on the type of medications they are on. PCOD does not define you for a deferral. But if the type of medications which are being there, if there are some hormonal treatments going on, then you can't donate. Then you can't.
Means it's good to check with somebody, a healthcare provider or an expert like you, to see if you fall in the list or not.
So the basic concept is, any of the endocrinal disorders, if you are on a hormonal therapy, you are deferred from donating blood. Any condition.
Can my travel history, or can somebody's travel history also affect the blood donation eligibility?
Yes. So travel history could be like, it could be if you are, suppose, coming from a country where a disease is endemic. isn't it? Suppose it's you're coming from Egypt and it's a West Nile fever. And West Nile fever is not in the mandate of India. We do not do West Nile testing. So that person cannot donate then. Okay. And similarly, if I say for the foreign nationals who are means they are not Indian origin and they're staying abroad and they come and donate blood with you. So you have to ask them that if there is a continuous stay in India for 3 years and more, then only they can donate. Otherwise, they can't donate.
All right. And how often can somebody donate blood? How often
Yeah,
can
that's a very good question. That वैसे तो people don't donate only, but 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 still, if I know about the frequency of donation, then it's also good. So our boys and males, they can donate every 3 months. Your body permits to donate every 3 months, and our females, they can donate every 4 months. And this is based on the replenishment of the bone marrow stores, which when you donate, then the bone marrow, of course, is it replenishes your cellular portion, and that cellular portion of your blood replenishes after 3 and 4 months respectively in males and females.
Is it also affected by age? For example, if I'm 23, it is different for me, and somebody who's in their 18 years, they're different?
No, it would not differ much because the age mandate is between 18 and 60 years. So everyone will have the same physiological phenomenon of replenishing the bone marrow at the same times. It doesn't differ. It only differs when you have some disease process. Then it would differ. In a normal, healthy person, it would not differ.
Very, very common misconception that if you have a tattoo or if you have a piercing, you cannot donate blood. And I'm speaking this from experience that somebody I met in office, went for a tattoo, and they said the tattoo artist said that you can't donate blood after that. So she dropped
Very true.
thing right.
Very true. Very true, because the reason of deferral is whenever you get a tattoo, it is for 12 months we will defer you. Now, why do we defer for 12 months? Because those tattooing is done in these studios or wherever, I don't know exactly, means it could be at the roadside. It could be at a very high-end studio also, but I don't know from where you got it. So this tattooing, the needles could be a source of hepatitis B. It could be a source of hepatitis C. It could be a source of HIV also. If they are not, if the process is done unhygienically, then it could be a source of all these infections. And the incubation period of all these infections lie within somewhere between 2 months to 12 months. So we defer the donor for 12 months. Later on, he can donate.
And is it also true that only people with rare blood types can donate blood and nobody else?
No, it's not like that. See, because blood is required every day. If I talk about a center like me, it could be an A blood group, it could be B, it could be O, it could be AB. It could be the rarer types as O negative, A negative, B negative, AB negative. There is no trends of blood groups that would go. Today, if it will be only A would go. There are no trending. So if I get a case of road traffic accident today with me downstairs in my triage, which is AB negative. So if AB negative I don't have, then how would I give it to that person? So people of all blood groups should donate blood. They should donate. Everyone should donate blood. It's not the rare. Rare is because it's a difficulty at times to get the rare blood groups. But then we have a strategy and planning to keep those blood groups with us in a manner that we can always give it to someone in need. We have those systems with us. Yes.
Right. And we definitely need those systems in, planning.
Exactly.
Yeah. So also, do you have to be in a perfect health to donate blood? Fever or smaller issues can affect it.
True. you have to be basically fit first. Only the people who are fit can donate blood. So fitness level, how I say, the weight should be more than 45. Your hemoglobin level is very, very, very important. Hemoglobin should be 12.5 grams and above. So क्या होता है, our female stuff will not have. They will say, ma'am, my hemoglobin is 8. Isn't it? So she's not fit to donate blood. So 12.5. So fitness is utmost. You should not have any chronic diseases like of liver, kidney, brain, nervous system. So again implies to being fit. Then it's no other diseases of, I mean, gastric diseases. Nothing should be there. Acid means peptic disease. You should not have that. So there are, I mean, these chronic diseases you should not have. So if you don't have the chronic diseases, implies that you're fit. You have to be fit to donate blood. Yeah.
And I'm just curious, is it that the hemoglobin level in women are comparatively low as compared to men?
Lower they would be, definitely, but 12.5 is the cutoff. That's the standard level that you should have as a fitness marker. 12.5 is the minimum level that marks you as good. I mean, fit. And usually why females will have less? Because they would not eat properly. In married females, they have their own limitations of first serving the family, doing a lot of multiple chores, and then eating the leftovers. See, anemia is a very big problem in our country, and anemia in females is a very major problem in our country. And why it is not looked upon? Because even till the levels of 7 and 8, you will keep on going. Nothing will happen to you. I mean, your energy levels will be low, but you will not feel that I have a disease. So only when you go and get yourself tested, then you'll come to know, oh, it's 6. I didn't realize that. So that's what my urge from this platform would be to all females, please take care of yourself. Because I always, this line I always tell in my talks when I give to my staff and to my max staff, when I always talk to them, is that whenever you go in an aeroplane, the air hostess will come and say, put your mask first and then help the others. So here your mask is your hemoglobin. You don't have your mask itself. How are you going to, being in medical also, even my kids, they will say they cannot donate because hemoglobin is less. So I always tell them, being in medical field also, if you can't maintain your hemoglobin levels, means that's not good. It doesn't give you immediately a sense of being sick, but then it affects your organs very badly. So we have to take care of that. Yes.
Right, absolutely. Also, any is diet associated with it? Can vegetarians or vegans donate blood, or is it different for the dietary, changes also?
Why not? Vegans and vegetarians are equally fit as the non-vegetarians to donate blood. But the only thing is, because vegetarians have to put in a more effort to maintain the diets. And nowadays, the world is shifting from non-veg to veg. And vegetarian diet comprising of a lot of means green vegetables. And these means if you start including all that, and jaggery, if you include a lot of it. Jaggery is such a common thing, you can all eat it. So jaggery is so good. It does not need a chicken to replenish your. It doesn't need. You can always replenish it with, even a small piece of jaggery. Eating jaggery after your food, not eating any fancy desserts. Just eat a little piece of jaggery. It takes care of your hemoglobin so well. So vegetarians and vegans are equally fit to donate blood. They can.
And can donating blood make somebody sick or weak?
Not exactly. Because the blood which we are drawing from the patient, it is from the donor, not the patient, from the donor, is actually in physiological amounts. Okay. So physiological amounts means that that's the limit, that's the ml of blood that permits us to take it out from the donor's body without doing any harm to him. And 350 ml and 450 ml blood are taken. 350 ml, I told you, if the weight is between 45 and 55 kg, 55 kg and above is 450 ml. So it doesn't harm. But at times, there are donor reactions. What are these donor reactions? Like first is you faint. After donating blood, you faint. And the sight of blood faints you. Even when people are giving a sample, when I'm about to do a platelet pheresis, I draw a sample to test. Before I do the procedure, I test the entire blood. So I draw a sample from here. And when I draw a sample from here, the donor faints. So I do not take blood from him, because then I have to keep the donor on an hour's procedure to take platelets. So that is very common, not very common. 1 in 10,000 people faint. And that can be prevented also if having a lot of liquids before giving the donation, and similarly drinking a lot of fluids even after the donation. It prevents the vasovagal. This is known as vasovagal infection, means reaction. And it happens at times. But that should not deter you from donating blood. It's a thing which, I mean, it's okay to have it.
Right.
But then you can't stop trying to donate blood, okay?
Correct. And then you also get some, hampers and everything like fluids after you donate blood. So
Yes,
people
yes.
go for that.
After you donate blood, you have to be under observation of the blood center for 10 minutes. And in those 10 minutes, we give you certain fruits or, juices to drink and something to eat. And that main purpose is to have you and keep you under observation for 10 to 15 minutes. So that we could look at you that no reaction is happening. So no donor reaction happens to you. That's why we make you sit there.
Okay. And can pregnant women also donate blood?
Pregnant women can only donate blood after the delivery, 12 months after the delivery. And that too, if she's not feeding the child. Lactating females will donate only after they have weaned off the child from feeding milk, else they cannot donate.
And one, last question that I have: how long does it take for you to take the blood, and like how long does it take for the entire
5 minutes.
to happen? 5 minutes.
5 minutes.
Okay.
So the actual procedure of donation is only 5 minutes. We are not supposed to take the blood more than, if the time period is between 5 and 7 to 8 minutes, that's the best blood. We cannot extend it to 15-20 minutes, because the blood that is coming into the bag has to be with a free flow, and there is an anticoagulation which is there in the blood, and the blood should not clot. So if I extend the time period more than 10 minutes, the blood will clot in the tube itself, which we cannot do. But the other time that is being taken is, you have to fill up a questionnaire. The questionnaire is a big questionnaire. It asks you, did you sleep well? The question is very, very relevant, because if you didn't had a proper sleep, then you should not donate, because chances of vasovagal reaction would be higher if sleep is not there proper. Then second thing we ask, did you have a proper meal within 4 hours of your donation? So the people will say, yes, we had it. And they are empty stomach and they will donate. So because I'm taking out certain amount from you, if you donate, you will faint. That people don't understand. So that questionnaire that you're filling up is a big questionnaire. It asks you so many things. Whatever you asked me just now, most of the things are there in it. Whether you had any chronic illness, your blood pressure, medicines, any liver diseases, kidney diseases, any convulsions, epilepsy. They ask you everything. They even ask you about your sexual behavior. Whether you have had multiple partners. So because why we ask that is because the chances of these HIV are increased in people who have multiple sexual partners. And HIV is one disease which is transmissible through the blood. So you have to fill up that questionnaire very nicely and honestly. So that takes about 5-10 minutes. Then once you come to the doctor gives you a physical examination, and that takes another 5 minutes. Then you go and get your hemoglobin checked. That takes another 2 to 3 minutes. So the entire process, the turnaround time for the entire process would be somewhere between 30 to 40 minutes.
About half an hour, then you're done, including the observation time also.
Correct. So that, but the actual process is just between 5 to 10
5
minutes.
to 7 minutes. Okay.
Correct.
Done.
Correct.
So that were all the questions that we had, and I'm just hoping that people watch this video, their myths are gone, and they show up this year to donate blood in the maximum amounts. Thank you so much for joining.
Thank you so much, Mehak. And tomorrow is actually World Blood Donor Day. I urge all my youngsters to go and please donate blood in the centers, the licensed blood centers which are near to you, or at camps which are being held throughout your areas, which are being held by good licensed blood centers. So I wish we inspire people to donate blood so that our country is not short of blood. Thank you so much.
Thank
Thanks
you
a
so
lot.
much for joining us. We'll see you
Namaskar.
again.
Thanks a lot.
Okay,
Bye-bye.
bye.
Bye.